All right, let's talk about the incredible high-stakes drama that's playing out inside our heads right now. We're going to look at the skull, not just as a piece of armor, but as this rigid, unmoving pressure cooker where even the tiniest change in balance can lead to huge consequences.
So, to kick things off, a little bit of a puzzle for you. What on earth could a leaky spine, a brain tumor, and a blocked drain possibly have in common? I know, it sounds like the start of a bad joke, but the answer is actually the key to this whole explainer: intracranial pressure. So first up, we need to understand the skull's one rigid rule. I mean, to really get how things can go so wrong inside our heads, you have to start with the fundamental principle that governs everything in there. And that principle is called the Monro-Kellie Hypothesis. It sounds fancy, but the idea is actually super simple. Think of your skull as a sealed, rigid box. It can't expand. And inside, everything, all the contents, they're in this delicate state of balance, this equilibrium. You can't just add something new without something else getting squeezed out. So inside that fixed space, you've got three key players. First, the brain tissue itself. That's the big one, about 80%. Then you have blood and this special fluid called cerebrospinal fluid, or CSF. And the rule is absolutely non-negotiable. If one of these things increases in volume, let's say you have some bleeding or a tumor starts to grow, one of the others has to decrease to make room. It's a constant high-stakes juggling act. So what happens when that balancing act fails? Well, that's exactly what we're diving into now, when pressure goes wrong. And we're going to look at the two sides of that coin: having way too little pressure and way too much. And this slide breaks it down perfectly. On one side, you've got intracranial hypotension. Think low pressure. This is usually caused by your CSF leaking out somewhere. To try and fill that empty space, the body dials up the amount of blood in the veins. On the other side, you've got the opposite problem: intracranial hypertension, or way too much pressure, usually from too much CSF. Here, the body tries to make space by squishing the venous sinuses, which can cause the brain's ventricles to get squeezed into these tiny little slits. And just to give you a mental picture for that high-pressure state, the classic textbook case for this condition, sometimes called Pseudotumor Cerebri, is a middle-aged woman who comes in with a headache that just will not quit. It's a really helpful way to kind of anchor that concept. And that whole idea of too much fluid is the perfect lead-in to our next topic: hydrocephalus. This is really what happens when that whole CSF plumbing system just completely fails. Now, you might think hydrocephalus is just one thing, but it's not. There's a really key difference here. With communicating hydrocephalus, the fluid can get out of the ventricles just fine, but the drains are clogged downstream where it's supposed to get absorbed. So what happens? Everything backs up and all the ventricles get big. But with non-communicating hydrocephalus, there's a physical blockage, like a tumor or a cyst inside the system itself. It's like a roadblock on one specific pipe. So only the ventricles upstream of that clog swell up. And for one specific kind of hydrocephalus, there's this clinical shorthand that's, well, you'll never forget it: wet, wacky, and wobbly. It's used to describe something called normal pressure hydrocephalus, which you often see in older patients. Wet refers to urinary incontinence, wacky points to confusion, and wobbly describes their unsteady gait. It's a memorable, if blunt, trio. Okay, so if you've got a major plumbing problem in your brain, what do you do? Well, that brings us to the modern solution. We're talking about shunts, which are basically a relief valve. It's a true engineering fix for a biological problem. So how does this little piece of engineering actually work? It's really elegant in its simplicity. You've got three parts. First, a small tube gets placed inside one of the ventricles to collect that extra fluid. Then, there's a tiny one-way valve that's designed to control how fast the fluid can flow out. And finally, there's a long, flexible tube that carries that fluid away and drains it somewhere it can be safely absorbed, usually into the abdomen. But just like any plumbing, things can go wrong. And the common problems link right back to our pressure principles. You can have undershunting, where the tube gets clogged and doesn't drain enough, so the pressure builds back up and the ventricles get big again. Or you can have the opposite, overshunting, where it drains too much fluid, causing the ventricles to collapse and potentially leading to really dangerous bleeding on the surface of the brain. And of course, you always have to worry about infection. And this brings us to where it gets really serious. What happens when all the safety valves fail, when the body can't compensate anymore, and the pressure just keeps rising with nowhere to go? That brings us to the ultimate consequence: brain herniation. And herniation, well, it is exactly as devastating as it sounds. We're talking about the pressure getting so intense, so overwhelming, that the brain tissue itself is physically squeezed and forced out of its home, pushed into a space where it absolutely does not belong. This chart shows the terrifying ways this can happen. Depending on where the pressure is building, the brain can be forced in different directions. It can be pushed sideways under a tough membrane. It can be shoved downward, where a part of it famously pinches the third cranial nerve, causing that classic sign of a single dilated pupil. The brain can even be forced upward, or, in the most dire scenario, the very bottom of the brain can be pushed down out of the base of the skull, leading to catastrophic compression of the brainstem. And get this, here's one of the most bizarre things that can happen, and it really shows the incredible forces we're talking about. The midbrain can be smashed so hard against an internal structure that it actually creates a physical notch in the tissue. Now, this can cause muscle weakness on the same side of the body as the brain injury, which is completely backwards, and can totally throw off a doctor's exam. It's a stark reminder of the sheer physical violence that's happening inside the skull. And this really brings us full circle, doesn't it? The very same rigid, protective skull that evolved over millennia to be the brain's ultimate guardian can, when things go wrong, become its most immediate and deadly threat. It's a profound paradox that sits at the very heart of survival inside our own heads.